There are lots of similarities between the upper and lower limbs. The main difference is that the muscles are much larger. Movements taking place at the ankle are dorsiflexion and plantarflexion. Dorsiflexion of the foot corresponds to extension of the wrist, and plantarflexion corresponds to flexion. In dorsiflexion, the foot is turned towards the leg. The ankle is most stable in this position as there is maximal congruence of bones. In plantarflexion, the foot is turned so that the toes point towards the ground. Movements corresponding to pronation and supination are eversion and inversion of the foot. In eversion, the sole of the foot is turned outwards. In inversion, the foot is turned so that the sole faces in. For sake of convenience, I'll describe the muscles in groups. It is beneficial to start with the osteology. We are looking at the lateral aspect of the left hip bone. It is formed by ilium, ischium, and pubis. All three bones take part in formation of this socket, the acetabulum. Attached to this area is gluteus medius, whereas taking origin from here, from this lower area, is gluteus minimus. This is the greater sciatic notch formed by the ilium as well as the ischium. This spinous process is the ischial spine. This rough area is the ischial tuberosity, and it gives attachments to the hamstrings. This part of the pubis is called pecten pubis, and attached here is the pectineus. This joins with the other pubic bone in the midline pubic symphysis. Here is the obturator foramen, which is covered by the obturator membrane, leaving a small gap for the neurovascular bundle. This is the iliac fossa, which is filled in by iliacus. This projection is the anterior superior iliac spine, which is palpable and gives attachment to the sartorius. Attached to the anterior inferior iliac spine is the rectus femoris, part of which is also attached to this area above the acetabulum. This area here is for articulation with the sacrum. The femur is the largest bone in the body. We are looking at the anterior aspect of the left femur. Here is the head of the femur, which articulates with the acetabulum. This depression on the head is the fovea, which is for attachment of the ligament of the head of the femur. This narrow area is the neck, and this may be fractured during falls, especially in the elderly. These two large projections are the trochanters. The greater trochanter gives attachment to many of the gluteal muscles. Attached to the lesser trochanter is the iliopsoas. This rough area is the gluteal tuberosity, to which part of the gluteus maximus is attached. Continuous with that, coming down posteriorly, is the linea aspera, to which many of the thigh muscles are attached. This area here is the popliteal surface of the femur, and these two are the condyles. The medial condyle is much larger than the lateral condyle. This is the lateral condyle, and here is the medial condyle. At the ends of the condyles are the epicondyles. I am pointing right now to the medial epicondyle, which gives attachment to the medial collateral ligament. Just above the medial condyle, this projection is the adductor tubercle, to which part of the adductor magnus is attached. The lateral epicondyle gives attachment to the fibular or the lateral collateral ligament, and this groove here that you see is for the tendon of popliteus. The two cruciate ligaments are attached to these parts of the two condyles in here. This is the patellar surface of the femur. In the leg are two bones, the tibia on the medial side and fibula on the lateral side. These correspond to the radius and the ulna in the forearm. Connecting the two bones is the interosseous membrane. The distal end of the two bones forms the bumps of the ankles called the malleoli. Tibia is the weight-bearing bone. The medial surface of the tibia is subcutaneous and can be felt quite easily. The tibia is also called the shin bone. The rest of the tibia gives attachment to the muscles. At the proximal end, this projection is the tibial tuberosity, to which is attached the patellar ligament. These are the condyles of the tibia, which articulate with the femoral condyles. Attached along here are the menisci, and attached to the condyles are also the cruciate ligaments. The distal end of the tibia, the medial part, forms the medial malleolus. These grooves are for articulation with the talus, and this is for articulation with the fibula. Most of the surface of the fibula is covered by the muscles. The proximal end of the fibula articulates with the tibia. It does not articulate with the femur. The distal end of the fibula forms the lateral malleolus. It articulates with the tibia as well as the talus. In the foot are 7 tarsal bones, which correspond to the 8 carpal bones in the hand. This is the talus, which is the link between the foot and the leg. It articulates with the tibia and the fibula to form the ankle joint. It's at this that dorsiflexion and plantarflexion take place. It also articulates with the navicular in front and calcaneum behind. Here is the calcaneus, the largest tarsal bone. It articulates with the talus above and the cuboid. Inversion and eversion of the foot take place at this subtalar joints. This shelf-like projection is the sustentaculum tali. This groove on the undersurface is for the tendon of the flexor hallucis longus. Attached to this part of the calcaneum is the tendocalcaneum. Note how the navicular is sandwiched between the talus and the three cuneiforms. This projection on the navicular is the tuberosity to which the tibialis posterior is attached. Here are the 5 metatarsals. This projection at the base of the 5th metatarsal is the tuberosity for attachment of the fibularis brevis. This can be seen and felt halfway along the lateral border of the foot. As I turn the foot, you can perhaps see this groove on the undersurface of the cuboid. It's in this groove that the tendon of the fibularis longus rests or passes along. We are looking at the anterior aspect of the right thigh for orientation. That is the anterior superior iliac spine. This is the pubic symphysis. Here is the patella. I will start by describing the muscles which flex the hip joint. They are this sartorius, lateralmost. This one is the iliopsoas, you're only seeing part of. And this one over here that is kind of hidden partly underneath this femoral vein, that is the pectineus. The sartorius extends from the anterior superior iliac spine, goes obliquely across the thigh, goes behind the knee joint, and then comes to attach to the medial surface of the tibia. Thus, it can act not only on the hip joint but also on the knee joint, and it flexes both the joints. This is the longest muscle in the body, and some people called it the tailor's muscle because of its actions. This iliopsoas consists of 2 separate muscles, which we will see in another specimen, but the two come together to form the tendon which attaches to the lesser trochanter of the femur. These 3 structures here going from laterally to the medial side are femoral nerve, the femoral artery, and the femoral vein. This muscle here extending from the pecten of the pubis to the shaft of the femur is the pectineus. Let us now look at another specimen to see the iliopsoas. This big pillar-like muscle is the psoas major. It comes from the lumbar vertebrae and comes down here. It is joined by this other muscle which is filling the iliac fossa. The muscle is called iliacus, and the two together then come down and insert. You can see this tendon follow it down onto the lesser trochanter of the femur. Thus, you can see the size of this muscle, the entire length, and see that this is a very powerful flexor of the hip joint. But when the muscles, the iliopsoas of the two sides act together and act from below, what they can do is to flex the trunk and enable you to do sit-ups. This is called psoas major because there is a smaller muscle called psoas minor, which is often absent, as was the case in this specimen. When the psoas minor is present, you just see a little tendon lying on it, and the tendon attaches to the pelvic brim, does not go down into the thigh. This big muscle extending from the hip bone, going all the way across the knee to insert onto the tibial tuberosity is the rectus femoris. Rectus because it is straight, and femoris for the femur in this region. As this muscle crosses two joints, it acts on both, but it flexes the hip joint, whereas it extends the knee joint. Here are three muscles that clothe the shaft of the femur. These are the three vastae. The three vastae, together with this rectus femoris, I'm pointing to the two cut edges of the rectus femoris, form a tendon or a muscle which is called the quadriceps or the quad. Patella or the kneecap is a sesamoid bone, in fact the largest sesamoid bone in the body, as it is contained within the tendon of the quadriceps muscle. This structure here is called the patellar ligament, also called the ligamentum patellae, and it is this which attaches to the tibial tuberosity. For eliciting a knee jerk, one taps the tendon at this point. The action of the quadriceps muscle then is to extend the knee joint, and all these muscles are supplied by the femoral nerve. On this side, we can see this is the cut edge of the vastus medialis. Here is the big bulk. It's quite a big muscle. This is the part of the vastus intermedius. This part here is part of the vastus lateralis, as is this. The vastus lateralis goes all the way around the lateral part of the femur to attach to the linea aspera. This, by the way, is the iliotibial tract, and we'll be talking about that later. In the medial compartment of the thigh are the adductors and gracilis. Actually, the gracilis, the thin, graceful one, has been cut on this side. It's the medial most muscle which extends from the pubis and then comes down to insert onto the tibia, and some call it the girl between two sailors, as it is inserted between the sartorius above and the semitendinosus below. The adductors are the adductor longus, which sometimes has a sesamoid bone at its tendon where it's attached to the pubis, especially in those who do a lot of horseback riding. The next muscle next to that is adductor brevis. It's much shorter, and hence the name, coming from the pubis going to the linea aspera, generally covered over by the pectineus. So here the pectineus has been cut to expose the adductor brevis. And the third adductor is the adductor magnus, which is really a very big muscle. Here is part of it, and the adductor magnus actually has two parts, a hamstring part and a true adductor part. And here in this specimen, the adductor magnus has been cut. So you are seeing this cut edge of the adductor magnus. Here is the other part. And this hole between the two parts is called the adductor hiatus, through which the femoral vessels come into the popliteal region and become popliteal vessels. I will use the ligaments body to show you the entire length or the entire extent of the adductor magnus muscle. The adductors, of course, adduct the hip. In this specimen, you can see the massive adductor magnus. It has been detached from its attachment to the hip bone, and it is still attached all the way around to the femur. This opening here is the adductor hiatus between the hamstring portion and the adductor portion of the adductor magnus. This muscle here that you are seeing lying anterior to the magnus is the adductor longus. That is the cut edge of the longus. Above that is the adductor brevis, and this here is the pectineus. This muscle here, by the way, is the iliopsoas, and you can trace it as it's on its way to attach to the lesser trochanter. As I turn the specimen, you can see the massive adductor magnus from its posterior aspect. In the gluteal region are many muscles which extend, abduct, and laterally rotate the hip. This is the gluteus maximus, which has been detached from its origin. This muscle is only partly inserted into the gluteal tuberosity. Most of the muscle, 75% of this muscle, is inserted into the iliotibial tract. The tract so called because it extends from the ilium above down to the tibia over here. The actions of gluteus maximus is to extend the hip. It is a very powerful extensor of the hip, used specifically for climbing stairs or getting up from a sitting position, etc. Also, it tenses the fascia lata by way of this iliotibial tract, and it stabilizes the femur on the tibia, especially when the flexed knee supports the weight of the body. It is innervated by the inferior gluteal nerves. In this specimen, the gluteus maximus has been resected. Here is the cut edge of the gluteus maximus. Also, this is part of it, and here you can see where it was attached to the gluteal tuberosity. As I turn it, you can notice this other muscle here, which is called the tensor fascia lata, another muscle which is inserted into the iliotibial tract. This muscle here that I am now tracing is the gluteus medius. You can't see the gluteus minimus in this specimen, and I suggest you see that in another one, because here it's completely covered over by the gluteus medius. These three muscles, the gluteus medius, minimus, and tensor fascia lata, abduct the thigh or abduct the hip joint. But the main function of these muscles, the gluteus medius minimus, is to prevent the pelvis from sagging whenever the opposite leg is raised off the ground. These muscles are supplied by the superior gluteal nerve. This here is the piriformis, pear-shaped muscle. That is the key to the gluteal region. You can't see its attachment, which is on the pelvic aspect. It comes from those pieces of the sacrum through the greater sciatic foramen, comes down across like this, and it's attached to the greater trochanter of the femur. Coming beneath that, this, by the way, is the biggest nerve in the body, the sciatic nerve, and also the inferior gluteal nerve would be inferior to the piriformis, the superior one superior to it. These two muscles which surround a tendon in between, here you may or may not see it that clearly in this specimen, but you can see it in another one, is the tendon of the obturator internus, which comes through the lesser sciatic foramen and comes across the hip bone like this. It's in this region that it's surrounded by these two gamella, the superior gamellus and the inferior gamellus. And together these three muscles are attached to the greater trochanter. Inferior to that, this quadrangular muscle is called the quadratus femoris. These muscles are all little lateral rotators of the hip. This, by the way, is the ischial tuberosity, and they say that the sciatic nerve lies on the quadratus femoris midway between the greater trochanter and the ischial tuberosity. In the posterior compartment of the thigh are the hamstrings, which extend the hip and flex the knee. They are coming from the ischial tuberosity, and this one right here, because it is half tendinous, is called semitendinosus. Along with this, and a little lateral to it, this one is the long head of biceps, which will join with this short head coming just from the femur to form the biceps tendon, which inserts onto the fibula right here. The third muscle, which is deeper to these two right here that I am pointing, is the semimembranosus, because though you can't perhaps appreciate it in this one because it's covered, the proximal half of that muscle is membranous, hence its name, semimembranosus, which extends from the ischial tuberosity and then comes down to attach to the tibial condyle. So you can see that all these muscles are going to flex the knee and extend the hip. They are all supplied by the tibial portion of the sciatic nerve. And when I say hamstrings, I am not including the short head of biceps, because you see the short head of biceps comes just from the femur, from the linea aspera, and crosses only the knee joint, so it only acts on the knee joint. It can have no action on the hip joint. And also this short head of biceps is supplied by the common fibular portion of the sciatic nerve. By the way, in this specimen, you can see the entire length of this muscle, and let me see if you can identify it. A muscle in the medial compartment of the thigh, this one here, and if you thought it's gracilis, that is correct. This, by the way, is the sacrotuberous ligament attached to the sacrum above and to the ischial tuberosity right over here. Now, a quick review of the posterior thigh. This here is the cut edge of part of the hamstrings, the superficial two, the long head of biceps, and the semitendinosus. This is the other cut end of the biceps, and you can see how the biceps goes to insert onto the head of the fibula. This other structure quite close to the tendon of the biceps is the fibular collateral ligament. And now that those two muscles have been removed, you can kind of trace the entire length of the semimembranosus and see how it comes down to insert onto the tibial condyle. This, by the way, is the semitendinosus tendon. Can you identify this muscle? It is the vastus lateralis. Yes, it seems to be coming in this compartment, but it doesn't, but this is how far posteriorly it extends. Let's now move on to the leg. I'll start with the anterior compartment, then do the lateral compartment, and then describe the muscles in the posterior compartment of the leg. This fascia that has been cut and reflected forms the anterior wall of the anterior compartment of the leg. And in this part here, it is still covering the muscles, but it's been removed in this part. These two bands that you see going across the extensor tendons, these are the superior and the inferior extensor retinacula. The muscles in the anterior compartment, which all cross anterior to the ankle, are thus dorsiflexors of the ankle. They are, the medialmost one here is the tibialis anterior, and you can see how its tendon comes down and then it inserts onto the medial cuneiform and the base of the first metatarsal. In addition to dorsiflexion, This muscle can invert the foot, and it also supports the medial longitudinal arch of the foot. The next muscle, which lies laterally, coming almost all the way from above here, coming down, and this muscle belly then splits into 4 tendons for the lateral 4 toes. This muscle is extensor digitorum longus. And besides dorsiflexing, it extends the lateral 4 toes. It corresponds to the extensor digitorum in the forearm and is inserted the same way, so it can extend all the phalanges. The muscle coming in between and actually only starts about halfway down the leg. You don't see that in this specimen. I'll use another one for that. But you can see the tendon as it emerges between the tibialis anterior and the extensor digitorum longus. This is the tendon of the extensor hallucis longus, which goes and inserts onto the distal phalanx of the hallux. And thus, in addition to dorsiflexing the ankle, it can extend the big toe. This muscle down in here crosses the anterior tibial vessels, and the order in which these tendons are at the ankle is tibialis anterior, extensor hallucis longus, anterior tibial artery or the dorsalis pedis, and then the extensor digitorum. Some people find it easy to remember this order by saying talkative husbands are not efficient. Part of the extensor digitorum longus does not extend all the way to the toes, but you can see it comes and inserts onto the 5th metatarsal. This little part of this muscle is called peroneus tertius or fibularis tertius. Here the muscles in the anterior compartment have been separated, so you can see them and trace them quite clearly. This is the tibialis anterior coming down right here. You can see in the middle how the extensor hallucis longus is coming down and follow it to its insertion, and lateral to them over here is the extensor digitorum longus with these tendons which have been cut going to the lateral 4 digits, as well as the fibularis tertius, which is just stopping short right here. In between, what you're seeing is the neurovascular bundle, and we'll describe that later. And by the way, this structure that you're seeing is a vein, and starting at the dorsum of the foot and goes all the way up across the leg and up the thigh. Any idea of its name? Give you a hint. It's clearly visible and always goes anterior to the medial malleolus. That is a landmark, and the vein is great saphenous vein. I'll describe the muscles in the posterior compartment in 2 groups, superficial and the deep. In the superficial compartment are the gastrocnemius, the soleus, which you're seeing only part of here, and one that you're not seeing at all in this specimen, the plantaris. These here are the 2 heads of the gastrocnemius, which forms bulk of the calf over here, attaching from to the medial and to the lateral condyles of the femur. The 2 heads come down and join with the underlying soleus to form this big thick tendon, the thickest, biggest tendon in the body, the Achilles tendon or the tendocalcaneum or the calcaneal tendon, which attaches to the heel bone, the calcaneus. This area, diamond-shaped area some people call, bound by the 2 heads of the gastrocnemius, and these 2 muscles being the semimembranosus and the biceps femoris, is called the popliteal area or the popliteal region. and these, by the way, are the nerves lying in there. For orientation, this is the semitendinosus, this is the semimembranosus. Here is the tibial nerve, which supplies most of the muscles in the posterior compartment. This is the common fibular nerve, and here is the tendon of the biceps. This is the cut edge of the soleus muscle, and here are the cut edges of the gastrocnemius. The muscles in the posterior, deep posterior compartment are this one here, the popliteus, which is the key to unlocking the knee joint. As you know, the knee joint is locked at the end of extension, and at the beginning of flexion, it has to be unlocked, which is done by the popliteus, which means lateral rotation of the femur on the fixed tibia. The other muscles in this part here, there are 3 of them. This one that we are seeing here that I am tracing down is the flexor digitorum longus. Then one placed in between that is not that clearly visible perhaps on camera is the tibialis posterior, and this lateral most big bellied muscle forming this tendon out here coming down is the flexor hallucis longus. The flexor digitorum longus, as it comes down, it is going down into the sole of the foot, and it divides into 4 tendons to go to the lateral 4 toes. The tibialis posterior, which lies in between actually at this point just at the ankle, it is crossed over by this flexor digitorum longus, so it ends up being medial most, and it then attaches to the tuberosity of the navicular bone. The flexor hallucis longus seems odd, it's the lateral most muscle, whereas the hallux, as you know, is the medial, so it crosses over in the sole of the foot to come to the position and then inserts onto the distal phalanx of the hallux. Besides being plantar flexors of the foot, the actions of these muscles, the flexor digitorum longus, of course, flexes the toes. The tibialis posterior, in addition, what it can do is inversion of the foot, and it is also a supporter of the medial longitudinal arch. This one here, the flexor hallucis longus, also supports the medial longitudinal arch besides being a flexor of the big toe. This, by the way, is the Achilles tendon, which has been cut, and you can see how it is going down. And just to emphasize, the order of the tendons here at the ankle in front behind the medial malleolus is Tom, Dick, and Harry, standing for tibialis anterior, flexor digitorum longus, and flexor hallucis longus. In the lateral compartment of the leg are 2 muscles, the fibularis longus and the fibularis brevis. The fibularis longus starts all the way from up here, and as it comes down, goes behind the lateral malleolus, across the sole of the foot in that groove in the cuboid, and thus it is quite long compared to the other one, and hence its name. The fibularis brevis starts a little bit lower down. You can see part of it here if you looked at it closely, and we'll see the tendon separately in another specimen, but that also goes behind the lateral malleolus. Then we follow its tendon right here, but then it inserts onto the dorsum of the foot on the base of the 5th metatarsal. Hence its name fibularis brevis. Because both these muscles go behind the lateral malleolus, they are everters of the foot. This nerve, by the way, is the superficial fibular nerve, and we'll describe it in another recording. In this specimen, the two fibular muscles have been separated, so you can see them clearly, and you can see how the tendon of the fibularis brevis comes down to the dorsum of the foot, and that of the longus is going across. In this specimen, you can see the interosseous membrane, and the muscles of the foot have been dissected, which you can review and learn on your own if and when needed. Right here, what I'm pointing to is the muscle called extensor digitorum brevis, and this divides into four tendons. The medial most of these slips goes to the big toe and is called the extensor hallucis brevis, and the other three tendons go to the medial three toes, and that's where they are inserted into the extensor expansion of those toes. It is this little muscle here on the dorsum of the foot which forms the little soft swelling on the foot.